I had a hospice patient today. And my privilege for today was to teach this family how to die. What happens when you die, the changes that come on. And I remember just feeling kind of out of place, but comfortable at the same time. I felt like I was lying to them a little bit. I'm like, wow. I felt so empty already, right? And I'm telling somebody else how to die. We basically let the body shut itself down, which is exactly what I was feeling. So maybe this was coming off as very natural, I don't know. But we give them morphine to take away the pain, to make them more comfortable. Because things can ache, things can be really painful, you can have a lot of chest pain, you stop eating, you stop drinking. It's kind of the state I'm in, stopped eating, stopped drinking. Depression's a common psychosis, or a common thing with dying. And for that we give Ativan and Haldol. The Haldol's for the nausea too, but the Ativan's more for the anxiety. So, and I wish I had that. I guess I'm using alcohol for my morphine and my Ativan combo. It works sometimes. And then we talk about some sad stuff. We talk about aspirating on your saliva, that when you stop drinking, your saliva tends to thicken up. And there's these drops we give atropine to stop the secretions, so that they're not choking on their own saliva, because that would be terrible. I don't know. You're sitting there choking. It's like you're drowning and you can't breathe, and then you black out and then you die. That happens a lot. So we try to avoid that. People can choke on their saliva when they're on their back and they're unable to swallow. It's partially why they're not eating and drinking. So, anyways, I just felt like I could relate with these people, I guess. I kind of had this moment of clarity here that I felt like I was dying too. So it was easy enough for me to teach them how their significant other was going to die. And maybe that's what made me a really good nurse today. Because I'm dying too, and I was able to teach somebody else how to die. You teach them, how to change their brief. I'm glad I'm not incontinent, even though I've gained enough weight where I have a hard time, wiping my own butt. So that's pretty close, right? I'm getting there. I'm almost there, I guess. And, it's sad at this age. It was nice there was such a big family there that was present. I feel like I'm going to be alone when I die. Whether early or late, it doesn't even matter. I still feel like I'm going to be alone, and I just was thinking about teaching hospice care to a patient that doesn't have family. And these kind of people usually end in government-paid facilities, where you'll have one nurse to 30, and nobody comes and visits you, and you sit there in your urine or your feces. They might change you once a day. I've seen it to where some of these places don't. And your end of life is sitting in your urine and feces, trying to get meds if they're not being stolen from the staff, being in constant pain, having a hard time swallowing, having a hard time breathing every day, just laboring to breathe. Coincidentally, that's how I feel kind of on a day-to-day right now, so I feel their pain, and that's why I want more for them. I want more for me, but I can't change anything right now in my life. And these people are in the same position. They can't change anything in their life. They can't even get out of bed. They have to wait till somebody changes their brief. To hopefully somebody wipes them. And they just, as they lay there, you don't notice it, but the bones in their back are pushing on, they're pushing against the bed, and they're breaking the skin down. And you get these pressure sores that are open for infection. And they're some of the craziest things you've ever seen. It's amazing the body can stay alive and have this going on with it, where half the foot is missing, and it's necrotic, and it's completely come down to the bone. And some of these people that I've seen, they're too old to get surgery. It's too risky. They'll die right on the table. And so they they do the antibiotic. We put some bandages on them to keep the infection from spreading as quickly or becoming septic inside their body. And they have to sit in that too. They keep their foot, but it's rotting away to nothing. They get to see what happens inside of a casket before they're even gone. They get to see their body doing that. I feel like for me, I'm watching my body just, I can't take care of myself very well because of everything going on in my life, and I'm watching it die pretty much, and it's not pretty. I feel so bad for these people that don't have anybody in their life to care for them, that are left up to government care, because it's not good. It's very lonely. They put a TV in your room, and it's unsanitary, and you're very likely to just die from some infection that's going to hit your system. Or a sad one is pneumonia, where, your lungs fill up with fluid and you can't breathe anymore. Again, you'll black out and you'll die. And, but not before you feel the pain of not being able to breathe, not getting enough oxygen. And, when you see it, you wish that we had quicker methods to get people out of here quicker. It's sad, but it's true. If you've seen it, it's not pretty. None of it is. It never is. It's terrible to die slowly. And it's terrible to hear people wishing that it was quicker. And we're not doing anything about that. It's terrible for young people in their teens to start dying slowly. Or me. I feel like I'm dying actually fairly quick now. But it's not a good feeling. A lot of suffering, a lot of pain. And it's so frustrating, and it's something to get so angry about. Not because somebody should give you everything that you need, but it's hard when you're grasping and you can't reach for anything.